Questions? Let's stop right here. Are there any questions? Yes.
I'm real confused about the grieving, the grief process because like, okay, 2 months ago, 2 years ago, 5 years ago, when is that line of when someone should, I hate to say it, but be getting on with life and getting over the grief and moving forward?
That may be the best question of the 7 weeks. Thank you. If someone is in a grief event and they've been in it for 1 year or 2 years or 5 years or whatever, when do we expect that person to get over it and get on with their life?
Or when do we say it's depression?
Or when do we say it's depression? And that's a great question. And the best answer is, I don't know. Okay? My response to my mother's death is going to be different than your response to your mother's death. Okay? My dad died when I was 19. I was first semester sophomore in college. I was 19, he was 50. We could probably go around and round up a bunch of 19-year-old white males from the deep south who were first semester sophomore in college, whose 50-year-old fathers died, okay? And we could all get in a big room, but I can never say, fast forward to week 7, I can never say, I know how you feel. I can say, I know how I felt. I know about my pain. But I can never presume to know how you felt, because that's a different relationship from my relationship with my dad. Okay? That is such a great question because there is not a great answer. Okay? And I think at some point we have to stop being silent. We have to trust ourselves with our rector or with a referral or with a primary care physician and say, I've got all these symptoms. It's been 2 years. I've not gotten over it. I'm still struggling. Do we need to try something and see if it works? That's why we say doctors practice, because we don't know. Okay? That's a great question. Any other questions? Yes, here and then here. Here.
A lot of the issues that you describe, and it's my generation or where I come from, you suffer when you lost your job, when you have a serious defeat. And in a way, culture have thought, well, you need to fight it over and you need to get over it.
Yep.
So, and that can be a process that is a week or can be a month until you get back on your feet and you move forward. So how you distinguish one from the other? How you distinguish the two depression? Was that a depression event that you were able to snap off it? Or is that a depression event that you will carry on for the rest of your life and you never got over it and you just cover it up?
That's a great question. And again, it's a similar question. How do you know if we're talking about a response to grief or if we're talking about a depressive disorder that's set in? I think one of the things we look at, again, back to John's question, is we look at family history. Is this a family that was prone to depression? Okay, and so it may be that what we're dealing with is something that was started as a trauma and kind of eased its way into a depressive disorder. This is where I think, and I don't like my answer, okay? This is where I think we have to be able to trust somebody and stay in conversation with somebody. Squirrels. Squirrels. It's the Auburn engineer. All time. Anyway, I should have said that. So I think that's what we have to do, is we have to be able to trust ourselves with someone and enter into conversation, and we may have to try some sort of chemical intervention and see if it works, but that's way down the line. Sir?
Yeah, I would be, and I would be concerned that, and I would be, since, that you talked about, like coffee and fever and everything like that. You can not do that thing with no other thing, but two things you can either, get somebody that know what they're doing.
Yeah.
Either keep you in the Lord hand, because I have been in a season, a long time. A long time ago when I was born, so, I know what you're talking about because, I didn't know I was gonna get out of seizure and then have heart failure and everything. And I used to take medicine and this used to be like so bad that you can't heal, you can heal but you can't see nothing. All you can do is hear somebody cocktail and like let you relax and feel like that, and then I got so better, but I stopped having seizures. The doctor told me and I stopped having seizures. She was gonna take me on medicine. So I could start having my seizure, and the doctor took me on medicine. So you can't do nothing about it, but them two things right there.
Go ahead. Thank you.
I lost my wife 15 months ago. It's been very difficult. But I was seeing a licensed mental health counselor in Pensacola, Florida.
Okay.
And on one session he said, well, how long has it been since your wife died? I said, 8 months. He said, well, it's time you got out there in the city and saw some ladies and had a good time. And I
I'm
said,
sorry.
I said, grief does not have a calendar,
Thank you.
but you and I do, and we're through.
I'm sorry that happened to you. I appreciate you telling that story. And this is why y'all are gonna invite neighbors to come in and we're gonna talk about grief and all this other.
Don,
Yes,
are the symptoms different for children?
depression,
Yes.
it's hard to say, 7, 8, 9, 10, 11, 12. Depression looks like what we're talking about here. We ask questions about sleep and appetite and mood. We ask questions about socialization at school. If someone's work performance decreases with kids, we talk about academic school performance decreasing. Okay, we stay in touch with the teachers and school counselors. Again, with adolescents, we see a lot of irritability and anger and volatility. Okay, I think the suicide PowerPoint has excuse me kids, I apologize, it says adolescence is like a house on moving day, a temporary mess. And that's the way it is, but it's also a mess for adults, so my apologies. But anyway, yes, kids, preschool, but walk around an elementary school for a day and then walk around middle school for a day and see how you feel within those 2 days. Because they're different. Their bodies are exploding. Everything is different, and the depression looks different for teenagers. It really does. Okay.
People that are depressed and just sleep all the time. Is it from the fatigue, or is it like to escape? Or
They feel fatigued.
it's
It's
more
not
from
all in
the-
their head.
Uh-huh.
They are fatigued. Okay. What we don't have the ability to do is to say you're moderately depressed, see, here's the blood work, or here's the x-ray, or you're severely depressed, or we got this depression that's really coming on, let's treat it while it's not such a big deal, okay? But in a full-blown depressive disorder, and there's someone who sleeps all day, they need to sleep because the chemistry's not right, and it's sending signals that they need to sleep. Okay, it's real. Okay? A lot of people avoid treatment. Well, people avoid treatment because they're afraid. But you know what? People are afraid to go to their oncologist also. How much easier would it be to treat stage 1 tumors than stage 2 or stage 3 or stage 4 tumors? One of the things that we're trying to do, the group that is least likely to get help in this city and in every city, the group least likely to get help, clergy. You know why? Because they think, and you think, that they got vaccinated the day they were ordained. They got the shot, okay? And they're immune from all of your incivility. They're immune from all the petty stuff that happens. They're immune from getting sick themselves. They're immune from having family problems or financial problems or parent problems, okay? And unfortunately, in the language of tumors, clergy typically get help when they're stage 3 or stage 4, which means when they're a train wreck. Okay? So there is the fear of getting help. There is the social stigma of getting help, about getting help. I can't do that. I can't go talk to anybody about this. This is so embarrassing. And a lot of that's the old messages about mental and nervous disorders, that it ain't real anyway. I just need to pull myself up by the bootstraps and go on with it. Okay? And denial. I think it was Pam Tillis that recorded the song Cleopatra, Queen of Denial. And so we have a lot of people who say, this is going to get better on its own. But let me tell you something else, okay? 70% of all cardiovascular deaths, heart attacks. 70% of all cardiovascular deaths, the physician should write on the certificate of death, guess what?
Okay.
Denial. 70% of all cardiovascular deaths, the person had symptoms at least 4 to 6 to 9 to 14 days before the event. 7 out of all 10. Only 3 people just kind of like fell over and died. Okay? And again, I don't want to hurt feelings. I'm one of those who should have died. I was 48. I had symptoms for a week. I was afraid. I was in denial. I coded in the ER at Baptist Hospital and died twice. Woke up and saw one of the chaplains, thought I was in hell. It was horrible. So we avoid treatment for these reasons. You had a question. Did you have a question after that?
Well, I was just going to comment. I'm the one Southern Baptist. I grew up Southern Baptist, but I didn't.
Okay, welcome.
But I'm really thankful for you bringing this out, because it is something that has a huge stigma. Can you hear me?
I can.
In the church. And it's something I've dealt with for about 15 years. But one of our pastors, the young pastor, he's on medication for it. And he had a guest speaker that watching him, I know about that too. Went up and asked him if he did. And he said he did. He's 48 and he just got on medication 2 years ago. So it is getting better.
Good. So there's one Southern Baptist on medicine. Amen. See those hands. Thank you. I don't want to take antidepressants. And we come back to shame. I shouldn't feel this way. I shouldn't be this way. I should be able to get over this. I should be able to shake this off. We would never say that about heart disease or cancer or rheumatoid arthritis or ALS. We would never say that. Yeah. This is 2016.
Can you also say people avoid treatment because of cost?
No, you can't say that. There is growing evidence, and I believe this completely, that untreated depression does exacerbate other medical problems. We know there is a high incidence of cardiovascular patients who had a preceding depressive disorder untreated. We know there's a connection between depression and cardiovascular disease, just as an example. Wrong way. What does treatment look like? Treatment looks like sitting and talking, psychotherapy. There really are a lot of people who are quite sensitive to medicines and who can't tolerate any medicine of any kind. So there are a lot of people who simply cannot take psychotropic medicines. You'll be either very, very happy or very sad to know that the FAA does not allow commercial pilots to take antidepressants. I personally think that they should all take them. And that way we can snag the ones who are depressed and we'd all be safer. When friends and family are flying somewhere, I tell them, I'm not praying for you, I'm praying for the pilot. You're kind of passive in that process. I remember working with a pilot, commercial pilot, several years ago, very, very, very depressed. Could not take medicine. Wanted to take medicine, was tempted to go ahead and take it anyway, could not take medicine. And we kind of got into a little banter every now and then because he would tell me his schedule for flying so I wouldn't be on his plane. It got to be kind of fun. Okay. But there is a process called cognitive behavioral therapy. Dr. Hodges is going to talk a little bit about that, really a lot about this, when he talks about anxiety and ADD, ADHD, where what we want to do is have you to let this part of your body take over and rule this part of your body, where we pay attention to what you're thinking and the oftentimes irrationality of your thinking, and how we can help you to change those thoughts. Now go back to the symptoms, to think about excessive guilt and worthlessness. Okay? And how do we help someone to begin to do something different with how you think about yourself? And so we talk about psychotherapy, cognitive behavioral therapy, and antidepressants. Now, I'm kind of on thin ice here because I'm not an MD, and I'm grateful for that. But let me tell you about antidepressants, okay? There are three chemicals in the brain that we're paying attention to: norepinephrine, serotonin, and dopamine. I do something? Okay. The best illustration anyone's ever given me is really quite clever and quite simple. Imagine you have in your brain, you have neurotransmitters, and the neurotransmitters are connected by the synapses, okay? And the theory is, we don't know this, the theory is that the neurotransmitters get dirty. And the image is like the old days when your old truck up at the farm and it wouldn't start and the spark plugs were fouled. Remember that? And somebody would go and pull the cap and would scrape the carbon off the spark plugs, put the caps back on, and fire up the old truck. Okay? The theory is that the neurotransmitters get dirty, just to use good old language, okay? And they can't fire. And in the not firing, we see all these symptoms, because these symptoms are regulated by different parts of the brain. Okay? And so what the medicines do, the medicines go in and cleanse, scrape the carbon off, cleanse the neurotransmitters. Now, one of the things that we know is that, and people say, well, why are there so many antidepressant medicines? That's crazy, because there's only depression. Well, why are there 12 medicines for hypertension? And why are there 50 different cocktails for chemotherapy? And why don't we all have the same vision problems? Because we're different, okay? And so one of the great things about heredity is that if I had a parent that was maintained successfully on 100 milligrams of Zoloft, good possibility that if I need to be on medicine, I'm going to be well maintained on 100 milligrams of Zoloft. So we kind of get a leg up with something like that, okay? So this is what we understand to happen with the medicine. One of the things I should have put on the handout, I think doctors do a good job in telling patients this, but I think sometimes we're so overloaded that we don't hear everything, and probably sometimes doctors don't say everything. These medicines do not work quickly. You may know that. Okay? This is not Advil. Okay? A good SSRI, selective serotonin reuptake inhibitor, is going to take 2 to 3 to 4 weeks. Okay? Now, if you don't know that or believe that, and let's say you start taking it and you feel a little nauseated, that's sometimes a real common side effect. Maybe a little lightheaded, maybe extremities tingle a bit. You know, that's to be expected. If you don't understand that it's going to take 2 to 3 to 4 weeks for the medicine to kick in and work, what do people do? This is crazy. I feel worse. Out of here. Okay? And so what happens is, then they get frustrated, all the stigmas, all the denial, everything kicks in, and we've taken 2 or 3 steps backwards. Okay? These medicines always take 2 to 3 to 4 weeks. Now, if you're talking about benzos, you know what I mean by benzos? Everybody know about benzos? Xanax, which is alcohol in pill form. Librium, Ativan, Valium. Okay? Those are really quick. And sometimes they're used successfully for really significant troubling onsets of anxiety that can tamp the anxiety down. But those work very quickly. But you got to make sure you know what you're taking and what it's going to do to you, okay?
You
Yes?
said it's like a pill form.
It's highly addictive. We don't,
Like alcohol.
we don't like, we don't like Xanax if we can avoid Xanax. Okay, because it really is highly addictive and,
That whole group,
you what?
That whole group is very difficult to get off of.
The whole group is very difficult to get off of. It's a lot of fun to be on it, but it's tough to get off, okay? It's kind of like, some of the stimulants that we'll talk about, all the Adderalls and all that stuff. Okay, good case scenario. Let's say that after 2 months, you feel like $1 million, okay? Winner, we got it, okay? Right medicine, right dosage, we're great. Okay, and so you say, man, stuff's not cheap, I hate medicine, I miss my wine, whatever you say, okay? No. You're gonna use this medicine for 9 to 12 months. I don't care how good you feel. Because what we know is that your brain has not fully healed in 3 to 4 or 5 months. It's kind of like we got all our kids in braces, okay? And when the braces come off, if the orthodontist doesn't use a retainer for another ever how long, what happens to the teeth? It's the same thing. So we're going to have somebody on this medicine for 9 to 12 months. Okay? No question about that. And we really push that hard. And people don't like to take medicine, people don't like the cost, the inconvenience, It doesn't matter. If you ask any physician, there are 2 things that really bug physicians. First is having to do with insurance companies. Okay? Second is patient noncompliance. Drives physicians just
Would you say that again, patient what?
patient noncompliance. Yeah. Yes, sir.
I can admit to being one of those.
Oh. I don't know how to respond. Thank you.
It's a common thread of people I know that have.
Yeah.
And the other thing they need to know is that except for Prozac, which has a long half-life, then often you have to wean down,
Well,
just like you wean up when you're already done.
thank you.
Supervision.
Yeah, you don't titrate up, you don't titrate down. And so what happens is people after 3 months, they feel like $1 million. They toss the medicine, and 2 days later, they are sick as a dog. Because most of these medicines, you have to titrate down. You have to go every other day, every third day, half dose, it's kind of like the guy with the 5 pots of caffeine, okay? You have to, slowly come off of it, okay? Now, let me put in something here. I couldn't find the article, and so I didn't want to put it up here. But let me tell you what we know. What we know is that if someone has an anxiety, depressive disorder, and they go see a licensed mental health counselor or a psychologist, a non-MD, okay? Those people get better at a rate of 33%. Now let me tell you something else that's pretty startling. If someone goes to see a psychiatrist or a primary care physician, I prefer a psychiatrist. We can talk about that if you want to. Go see a psychiatrist, gets a good diagnosis, clear diagnosis, starts the right antidepressant. They get better at a rate of 33%. If someone becomes involved in both modalities of treatment, psychiatrist, psychotherapy, cognitive behavioral therapy, they get better at a rate of 87%. Wow. Now, this raises some issues, and I don't want to get into it because it raises all kind of crazy issues about insurance companies and their refusal to pay for two mental health professionals, anti-medicine. It raises all kind of issues about time, about money. Okay, but one of the things we know is that when people move into a depressive disorder, they get into what AA guys call stinking thinking. They make bad decisions in family, bad decisions in life, bad decisions in business, all of the excessive guilt, all the things we talked about, okay? And just because the brain kind of heals, they still have these issues here to deal with, okay? And so I'm the most blessed psychologist in town, okay? Because we got a really cool place where we work. And I've got a psychiatrist out the other end, okay? We did it that way so we could be like far apart. But I'll send somebody down to him, and he'll send them back and he'll say, no, they have too much stuff to work with. I'm not about to medicate that. Y'all work for 2 or 3 months. If nothing gets better, send him back. Wow. Okay? Or he'll send me somebody and says, what do you think? And I say, I ain't doing this until you get this guy stabilized. Okay? It goes back and forth. Okay? People get better. People really, really get better. But they get better when they involve both modalities. Okay, and what I always say, and Susan knows this, I say, do you have a pastor? Because there's a component here that you need to pay attention to. And that is your spiritual component. And what are you doing with that? Because that is part of your healing. You've got to be involved in that part. That's got to be part of your life.
You said the 87% recovery, the psychotherapist and which other group?
Psychiatrist.
So does that mean they're taking the medicine
And talking.
and getting the psych?
Yeah, they're
At the same
taking,
time.
they're doing the right medicine.